Imagine a plumbing system, expertly designed and flawlessly functioning, suddenly experiencing a clog. What causes that initial blockage, and how does it affect the flow? It is a question many of us ponder when considering our own bodies, especially when it comes to vital arteries. Artery blockages are indeed often caused by plaque, which forms a sticky buildup on artery walls, and while these are not clots themselves, they can certainly create the perfect conditions for dangerous blood clots to form. This process begins with what is known as atherosclerosis. Think of your arteries as smooth, elastic tubes. Over time, factors like high blood pressure, high cholesterol, smoking, and diabetes can cause tiny injuries or damage to the inner lining of these arteries. When this damage occurs, it is like a small rough patch appearing on a smooth surface. Cholesterol and other fatty substances then begin to accumulate at these damaged sites, forming a soft, sticky material called plaque. This plaque hardens and grows, narrowing the artery and making it less flexible. A significant danger arises when this plaque ruptures or cracks. When that happens, the body sees it as an injury and sends platelets and clotting factors to the site to try to repair it. This response can rapidly lead to the formation of a blood clot, or thrombus, which can completely block the already narrowed artery. This total blockage is what often triggers a heart attack or an ischemic stroke by cutting off blood flow to vital organs. Understanding this critical connection means you can take proactive steps to protect your arterial health. Focus on managing your risk factors, which are the primary drivers of plaque buildup. This includes regular checkups to monitor your blood pressure and cholesterol levels, adopting a heart-healthy diet low in saturated and trans fats, engaging in regular physical activity, and avoiding smoking entirely. It is fascinating to note that not all plaque is created equal. Some plaques are stable and grow slowly over many years. Others, however, are considered vulnerable plaques. These vulnerable plaques have a thin cap covering a soft, lipid-rich core, making them much more prone to rupturing suddenly. It is this sudden rupture that often initiates the rapid formation of a blocking blood clot, even if the overall artery narrowing was not initially severe. Doctors are increasingly looking for ways to identify these vulnerable plaques before they cause a problem. So, while plaque itself is not a clot, it is the fundamental underlying problem that sets the stage for dangerous clot formation. By actively managing the conditions that lead to plaque buildup, you are not just preventing blockages, you are also significantly reducing your risk of a sudden, life-altering event like a stroke or heart attack, ensuring your circulatory system remains healthy and efficient for years to come.